So as of today, we have 2,406 positive cases of the coronavirus in Albany County, 467 people under mandatory quarantine, and an increase of 10 positive cases since yesterday. Among the new positives, we know one is a healthcare worker, 5 had close contact to a positive case, 1 reported traveling out of state, and 3 they're still working on the clear for the infection. So also today we have 8,368 people have completed quarantine. Of those, 2,362 tested positive for the virus and have recovered. It's an increase of 6 recoveries today, which is good. There are now 7 people hospitalized. We're up 1 from yesterday. We had 6 yesterday. Today there's 7, with a hospitalization rate of 0.29%. And of those who have tested positive, yesterday the rate was at 0.25, so it slightly went up because of the one more person. We still have 1 person currently in the ICU, so that number stands the same at 1. Over the last 5 days, there has been an average of 11.4 new positive cases each day. Yesterday it was 10.6, so going up a little bit. As we have said time and time again, what the governor continues to say, please go out, and Dr. Whalen and I are saying the same thing. In the beginning, you had to have some signs and symptoms. Now we're just saying, please get tested so we know. It's available, it's free. You can go to UAlbany, Seth Q Arena. We have the mobile testing sites, Rite Aid in Colony, and Gilliland, Priority 1. But again, University at Albany by calling 1-888-364-3065, and our mobile testing through Whitney Young, area code 518-465-4771. And as always, go on the website for Rite Aid, and you can click and go through the Colony site. And the same thing with Priority 1 in Gilliland. The number is still the same, 518-867-8040. I'll say this again, sound like a broken record. Please do the 4 things to keep this down: socially distancing, wearing a mask, continue to cough into your arm, and wash your hands, and we'll get through this. And some of the things, I don't read them all, but I do try to get on Facebook and check out all the comments and concerns and, my emails. So one of the things, Cynthia left a comment on our Facebook, and she really nailed it. And she spoke about how at the beginning of the outbreak, we sat here asking people to make some sacrifices to slow the spread of the virus in order to stop people from dying. First it was staying at home, now it's wearing a mask and socially distancing. Cynthia, you're correct. And she also wrote in there and continued on how we had many critics. And that's why I said early on, listen, it's easy to point fingers. It's easy to be a Monday quarterback. But we need to find the solution to the problem working together, not add more to it, to be proactive, not reactive, and be part of the solution, not part of the problem. And Cynthia, thank you for that comment, and you really nailed it. And, again, to the people that are doing the right thing, one of the things we can't make the prediction about is how many people's lives were saved because people did the right thing. I wish I could sit here and tell you we saved hundreds. I don't know. And they'll have the critics and the people that are saying no. And if I hear one more time, this is going to go away November 3rd, I can't even answer that question anymore. It's not going away. I hope it does. I hope we get a vaccine and we continue to reopen what we now have a new world that we're all dealing with. So Cynthia, thank you for your comments, and to everyone, thank you for your comments. I appreciate it. And again, we don't have all the answers, and sometimes it helps when someone's looking at it from a different lens, a different point of view than we are. Because sometimes you get bogged down in the weeds with everything. So thank you for your input to everybody, and not just on our Facebook, on all the media outlets and the Times Union comments and the news medias. It's helpful. It helps us all. But I just saw a report a couple days ago that showed Florida broke its old record for people dying in a single day, 276. That comes a week after they set a record for the largest number of hospitalizations in 1 week. We're seeing this all over the country, so it's clear we're setting ourselves apart here in New York, and I want to commend the governor for that. again, I understand the pain that people are feeling. Trust me. But if you look at what's going on around this country, people are shutting down, and it's hitting them like it did back to us 6 months ago in certain cases, and 5 here in the county, but 6 months overall, where we had them high hospitalization. Yes, people are getting infected. Our hospitalization rates is a little bit higher, the most it's been in a while, but again, not to the point we were 5 months ago. So I also want to point out a pretty shocking statistic that we continue to lose Americans to this virus. In 2018, the third leading cause of death in the United States was unintentional deaths, contribute to roughly 167,000 lives lost. The top 2 were heart disease and then cancer. As of today, we have lost 167,000 Americans to this virus. And my prayers and condolences to all the families that had to live through that experienced COVID-related deaths, which now has suppressed the unintentional deaths by the end of this year. So unfortunately, it's a number I'm not happy about. It's not something we wanted. It's not a goal that we want to brag about. But just to try to bring it to people's attention, the seriousness of this virus that continues to go out. I want to say, I was watching the special last night on TV, and they were talking about a university and how they had this rave party, and they had over 200 people get it, and luckily no hospitalization, but it can show you one slip up, one step back can take you really back for kids to go out and have fun. So again, please do the right thing, wear a mask, socially distance. I know you want to be kids, I know you want to go out and into these parties and have fun and feel normal again, but it's going to be a while, and then if you do the right thing, we'll get there. If you don't do the right thing, we're going to continue down this path. But Dr. Whalen.
Good morning. So we continue to track the cases as they come in and continue to work with our partners in the healthcare sector and the public to ensure that we are making sure that individuals who are diagnosed are appropriately isolated at home, and to ensure that contacts are under quarantine. This, along with the widespread testing that we're able to do in Albany County, again, is the strategy of halting the spread of COVID, and something that we've been committed to doing from day one and continue to have commitment to doing. As I've said the past couple of press conferences, I know currently the focus is on children and going back to school, and I think there's an important public health message that I think has been, we've talked about it previously at press conferences. There's been national advocacy for this, but I want to again reiterate for parents at home getting ready to send their children back how important it is to make sure that they're up to date with their pediatric visits. During the spring, we know that many people did not attend to normal preventive health services, and this was because they were sheltering at home. It's important to ensure that your child gets up-to-date, regularly scheduled preventive visits, and that includes keeping up to date with their pediatric immunizations. In New York State, in order to go back to school, we have mandates that those immunizations need to be up to date. So I would encourage parents to reach out to their pediatricians, make sure their children are up to date, because this is going to be very important going into the fall. Also, it's probably not too early to start talking about the importance of flu vaccine. When this becomes available, it is going to be important for all of us to be immunized against flu. We do advocate for this every year, but flu also can be a serious disease, not as deadly as COVID. The mortality rate is not high, but still, unfortunately, we do lose people every year to influenza. So in knowing the importance of getting your flu shot coming into the fall season is another thing that we want to stress the importance of.
Thank you, Dr. Whalen. Some of the other questions we've been getting are on weddings, and I know that we saw the 2 cases here in New York State where they sued, prevailed, and had their weddings. Over, I think it was 150 they were allowed to. get it. I know it's your happy day. I know it's it's one of the things that you look forward to in a relationship is to get married to the one that you love. But again, we're in a different environment, in a different world, and I can't, listen, I'm not going to make this argument. I can't argue why you're allowed to have protests, but you're not allowed to go to church, and you can't have weddings. It should be uniform across the board. But I will assure you, I know other people are probably going to sue, and I know the governor's office just tried to make an injunction from future weddings. I had to make that decision with my daughter, who was getting married in May, then August, now October. It's going to be under 50 people, and it was a hard decision to make, or wait to next year, and hopefully where things are open up again fully next year, and you can do it the right way. That's a decision the bride and groom have to make, or the two people who are getting married and in love have to make that decision. Do you want to do a Zoom wedding? Do you want to keep it under 50? Do you want to wait and do it next year? And I kind of joked with them. I said, do it backwards. Do the bridal shower, do the bachelor party, do everything backwards. Get married and then go backwards. Why not? Then you got something to talk about when we go. Can you imagine what happened in 2020? But that's all I can say. And one of the things we've been talking about is the small businesses, because I do mean this. They are the backbone of our community. They're the ones I want to champion for. Look at, I can sit here and cry all day about what my budget's going to look like in the coming months, and some of the steps we're making. We're going to be offering incentives very shortly for people to retire, to leave government. I'll be sending that email out. My staff is probably freaking out right now because they're working on it to send it out. But we have to make steps. Things got to change. But in government, we have revenue that come in on sales tax, property tax. But you think of a business owner that doesn't have that luxury. I was just talking to a person that has a great sandwich shop in downtown Albany. I went in there yesterday and talked to him. And he said, I'm losing $2,000 a week. And yes, he got all the PPE grants and everything else and CEG, and he goes, I'll be closed by November because I can't make it if things don't pick up. At least they're opened in trying to bring some revenue in and help them out. But then you think about the other independent gyms, and there's a lot of people with independent businesses throughout the county, again, that pay our taxes, pay workers' comp, pay for employees. And it's not easy to start your own business and to keep it running. And obviously, you got to base it on clientele coming in and doing the right thing. So they're all open. By phase 4, they'd be open. And, one of the pushes I made with a talk show person yesterday, they asked me that question. And they said, what do you think? And I go, well, we got schools opening in the fall. What better way to see how this is going to go going forward? Open up the gyms and the movie theaters and see how it goes, and do it slowly and like we've been doing. And I commend the governor what he's doing. Again, it's hard to make these decisions when you got to sleep at night and put your head on your pillow and hopefully what you're doing is the right thing. And I don't want to speak for the governor, but can assure you he probably took that, every death here in New York State personally, because you do, if you care. So Anna, who owns the DNA Body Works, she's a life coach and personal trainer who does rehab training and functional physical movement. She got a CEG grant for $5,000, which helped her get through so far, but she still has to continue on and try to make it work. And I don't know, and I can't speak for her, for how long she's been shut down and not knowing when they're going to open up and everything she did. So, but instead of hearing from me, people want to hear from you and how you're doing and how you're moving forward and how you reimagined what you're going to be doing when you open, if you get the green light to open up today.
All right. Best case scenario is that we do get the green light to either open today or very much in the near future. I want to thank you for this opportunity to actually speak about how challenging it has been since March up until now, and how helpful the CEG grant has been to the reimagination or reimaging of DNA Bodyworks. As the county executive said, my name is Anna Lucet-Shallow. I'm known as Anna. I own DNA Bodyworks. I have been a personal trainer for 10 years. I have had the business on the books for the past 4. It has been a very trying time, not only for my clients that I would work with, but also for myself. As a trainer, you start going through these things in your mind as what's going to happen, what's next, what are we going to be doing? And what I was able to do is take that opportunity to fall back a little bit and figure out what would be my next step. What is the best case scenario for DNA Bodyworks moving forward? So there were a couple of businesses online, UBQ Fit, that I joined and was actually able to do some training, online virtual training and things of that nature. And then I was able to start using YouTube and then Facebook and reaching out to my clients that were actually willing to do some virtual training, because it's a change for them as well. You go from having someone face-to-face with you correcting your movements to relying on someone through either a phone or your computer or something or another to do that same thing. Then the opportunity came with the KeyBank Jumpstart grant program that was monitored by CEG to apply for this. And they were looking specifically to help minority and women-owned businesses who did not qualify for the PPE. And my business fell underneath that particular category. I was a recipient of $5,000, and what I was able to do is a little bit of paying it forward. So if you go online now to look for my website, you're not going to find it. And the reason is it's being redesigned by AK Design, Ashley Kensley, who is also a minority woman, who does website and social media, different things. I was also able to partner with It's Only Wait, owned by Anthony DeLella, who helped me reimagine programming, what that would look like for people not face-to-face, but now kind of like virtually. In addition to that, we were able to start using Empire State Plaza, which is phenomenally used for some outside. Why are you laughing? I'm going to have you run the stairs.
We'll talk about that later.
We were able to use that and start doing some outside training. A lot of outside. So because it's great weather in upstate, as Dr. Whalen said earlier, you get outside and you move around. I think one of the things I remember the governor stating in the very beginning, that it was important to keep your cardiovascular system open, moving, getting some fresh air. It was wintertime. None of us really wanted to do it. It's not wintertime any longer. What I was able to do also was to really think about this whole thing differently. And I ended up getting my life coaching certificate. So what better way to inspire other people to do some physical movement, but also help them change their lives along the way, and rediscovering what their why is, and having them attach themselves to that why and then move themselves forward with the physical fitness, behavior change, and try to put COVID behind them a little bit, because it is a stressor, and just think about moving forward from there. I think that's about it.
It's a lot.
It is a lot.
It is a lot.
Oh, I did forget one thing. The services that I am able to provide is virtual training, outside training, making sure that I do everything based on the COVID standards of 6 feet apart, things of that nature. Like I said, we use the parks, we use Empire Plaza, and if anyone is interested, you can find me on IG underneath Anna Lucette, or you can look at me on Facebook right now at DNA Bodyworks. You can also find Ashley Kensley at AK Design, also on IG, and you can find It's Only Wait underneath Anthony Carlo on Instagram.
Thank you, Anna, and I appreciate that. And again, it's people like you that are the backbone of our community that we do need to start getting the door open and seeing how this is going to affect us going forward. And I know we're doing this slow. I know the reason why we're doing this slow, because of what's going on down in other parts of this great country of ours. But it's time that we give this an opportunity, especially before schools open up. And like I said, I've have some meetings set up with some of the presidents of the schools, teachers union, to discuss some of the stuff and their concerns and how school is going to be reimagined. And actually had to have a discussion with my wife last night at how we're going to send my daughter back to high school, and you either pick stay at home 1 day a week, and they're only going to go back 2. So it's either 2 days max or 1. And, not that I was trying to avoid that conversation last night. My mind's going, I'm like, what are parents going to do when the kids are home? that or have to go back to work. So if schools, and I'm just talking in the city of Albany, but if this is how schools are going to go forward, daycare is going to be a huge issue, and we need to tackle that issue. Sitting is going to be a huge issue because whether a parent can go back to work, if they're fortunate not to be laid off or through this whole COVID-19, what happens to the kids that are home all day? There's an issue in the summertime getting kids off the streets, keeping them safe. What are we going to do when they're not in school? And it's going to be a big issue that we have to address, and that's one of the things I'm going to talk to the superintendents about and the other mayors and supervisors in the whole county, because it's just not a city issue. This is a whole county issue. So again, please, it's something that we need to think about moving forward, and I will challenge the other places like the YMCA and Boys and Girls Club that we have to come up with alternatives that are going to work and be safe. But to Anna, thank you again for
Thank you.
In trying to get through this. I do truly appreciate it. On a different note, I do want to give a quick shout out to Pastor Charlie and the Victory Church for providing lunches for the kids who are taking part in our summer fun in Bethlehem all this week, which it was in Cohoes before, now it's in Bethlehem. Pastor Charlie has come out and fed the kids with lunch, so thank you, Pastor Charlie, for what you're doing and continue to do in the community. It's great that we've got these lunches available for the kids on top of great socially distancing games. And I had the honor of walking through with Mayor Killer at the time in the city of Cohoes and checking it out. And again, you can do things. Kids can still be kids and socially distance. I also want to say about basketball, I can't have any more arguments with coaches and families. It's a debate. I'm gonna say, look, I don't know what to tell you. It's not allowed. It's a sport that shouldn't be played. But yet, as you drive around the city of Albany and other places, I'm not just picking on the city, have full basketball games going on. I saw ones with refs, myself, and the table set up, and what do you do? Again, the virus is there, and it's a call you parents have to make. And thank God it's not affecting our younger population like it has in other parts of this country and around the world. And thank God. I know kids just want to be kids, but I'm saying to the parents, please continue to do the right thing so we can get through this. And by doing the right thing, our numbers are low, and we hit the apex, and now we're down, and we're kind of spiking up and going down, but please continue to do this so we can get through this. As always, we have the mental health hotline available 7 days a week, 8 a.m. to 5 p.m. The number is 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Our 211 number in the New York State hotline, as always, the 188-364-3065. Again, please continue to do the right thing out there. Stay healthy and safe.